This subject is going to be about severe allergic reactions, or what's sometimes called systemic allergic reactions, or anaphylactic shock would be the proper medical term for it. Severe allergic reactions can manifest themselves in a number of ways, but how do we prevent severe allergic reactions? I think that's what we need to talk about first. In the first years of life, infants especially, they should be introduced foods and watch for any type of allergic reaction when you introduce infants to new foods. Introduce them a week at a time. And they may be allergic to of course, there's so many allergies to peanuts these days. And but you know, of course, that would be later in life or a little bit later in childhood. But introduce foods slowly and just kind of look out for things like rashes that may appear. Of course, we'll talk about what a systemic or severe allergic reaction looks like in a minute, but prevention first. So for infants, watch that food and introduce them to them slowly. When you introduce new toys to them, sometimes there can be allergies to toys or pets, things like that. Not necessarily life-threatening, but we need to watch out for things like that. So whenever new pets come into the house, you know, watch out for any changes, any rashes or sneezing or things that would suggest that there's some type of allergic reaction there. Toys, you should do the same thing, especially plush toys that may include fibers of some type that they could breathe in or inhale. One thing you need to do, another thing I'll tell you that some people don't think about, when you have new carpet placed in your house, it's probably a good idea to keep that infant off the carpet for a month or so, especially if they're in a crawling stage, or at least make sure that you vacuum daily, because carpets shed more frequently. They shed constantly, believe it or not, but carpets do shed more so whenever they're first bought. And carpet fibers can produce allergic reactions, and that's been documented through the years to certain individuals. So vacuum them real well, you know, on a daily basis to make sure that the infant doesn't get a lot of this that could be a potential allergen to them. You know, severe allergic reactions, there's other ways to prevent them, you know, stay away from bees and things like that. But there's going to be certain situations, you know, where they do occur. Now, another way that I think that we can prevent these allergic reactions is from childhood. Let kids get dirty. We live in a society that's too clean, and that's a big problem in ways, I think. We're always wanting to use hand sanitizers, and whenever I was growing up, I don't know about y'all, but whenever I was growing up, we got dirty, and there's an old saying. Look it up on one of your search engines. Just query the term peck of dirt, P-E-C-K of dirt, and there's two versions of that. You're supposed to eat a peck of dirt before you die, or before you're 12 years old. And we actually eat dirt a little bit all day long. Every breath that we take, we're breathing in particulates or dust, and that's dirt in a way. And if we don't cough or sneeze it out, it'll go down our digestive tract. So we're probably eating dirt a little bit as we talk right now. But a peck of dirt's a lot of dirt to eat. No, that's a third of a bushel. That's about that big around, about that deep. Kind of picking on it. It's not too bad. The red clay, if you put a little hot sauce on it don't taste too bad. No, I'm just kidding. Don't do that. But let kids get dirty. I remember whenever we were growing up, we would do things like rake leaves and have to work in the yard. But when we raked those leaves, we got them in a big pile. When you got them in a big pile, everybody knows the benefit there. You jumped in it, yeah. And all of this dust, and all this mold, and all this fungus, and all these things that could produce allergen, you know, good bacteria from the earth, we inhaled it, and we got basically just all washed all over. So you remember that dust from the leaves that would come up. You know, whenever we were growing up, we were allowed to play in the woods. And if you got a little dirt in your mouth, you just spit it out and kept on going. Nowadays, parents, sometimes they're so obsessive at times, kid gets dirt in their mouth or eats a little piece of mud pie, they're going to, you know, take them to the dentist and get their teeth cleaned and wash their mouth out with Listerine 3 times. We don't need to be like that. And let me cite a study, because I think this is very important to talk to you about. There's a study right now going on in England, and there's 1,000 people in this study. 500 of them they all have infants. These couples, out of these 1,000 couples and 500 infants, well, some of them were twins. 500 of them, they said, when the baby loses a pacifier, do it the old-fashioned way. Take that pacifier, pick it up off the floor, stick it in your mouth, mom and dad, clean it off, and stick it back in that baby's mouth. And then in the other group of 500, they said, no, don't do it that way. What we want you to do is we want you to take that pacifier and you go to the sink and wash it off with tap water. Use tap water. And then put it in the baby's mouth. Guess which group, so far, they've been studying for about 3 or 4 years now, guess which group has less allergies, less upper respiratory infections by 20%. You probably already know, I've given it away there a little bit. It's the group where the parents were allowed to do it the old-fashioned way, by licking it off and sticking it in the child's mouth. Now there's two suggestions to that study. Either introducing a little bit of dirt to the baby in that form builds the immune system up, or the parent has something in the saliva that would help the baby and its immune system's development, or a combination of both. It could be a combination of both. They haven't figured that out yet, but 20% less in the old-fashioned way of doing it. So we need to let kids get dirty, and I think that's the key to building up these allergens, or being able to reject these allergens that are really not that frequent. Peanuts these days. A lot of kids are allergic to peanuts, and I'm a little bit concerned about that. Either they're genetically modified, or I think that they're a root crop, and there's some type of bacteria, virus maybe in there, a fungus or mold or something in there sometimes that could cause these issues. But we don't really know why. But there are a lot of people. I know when I was growing up, and probably when a lot of y'all were growing up, half the people in school, in their lunch boxes, there were peanut butter and jelly sandwiches and an apple or something like that. I'd have probably died growing up if it wasn't for peanut butter and jelly sandwiches, or pork and beans. Take your pick at lunchtime, and then get out of the house so I can watch my soap operas. That's what Grandma always used to say. So let these kids get dirty, and don't worry about it. That's what baths are for. They can take a bath later and wash up. So in those situations, let the kids get dirty, and maybe we can prevent some of these allergies from occurring. Now, every medicine cabinet should always contain Benadryl. Benadryl is very important. It's a fast-acting antihistamine, and it can be in liquid form or pill form. Liquid form for younger children. And the 911 dispatcher, if you don't have an EpiPen or epinephrine, will suggest that you give some dose of Benadryl to that patient. So it's very important to have in the medicine cabinet. It saves so many lives, and it also is used for pets too, in situations where they have some type of allergic reaction, or they get bit by a spider, or get into a yellow jacket nest or something like that. Well, with these severe allergic reactions, you can also have EpiPens or epinephrine, and we'll talk about that later. And I'll also show you how to inject with the EpiPen, in a moment here. Now, what does a severe allergic reaction look like? If we can't avoid it, what does it look like? What happens is, generally there's just a generalized rash that breaks out over the chest cavity up to the neck. Sometimes that's all avoided, and severe allergic reactions just start the facial area here and work their way up. Lips will swell very quickly. Eyes will swell very, very quickly and almost shut sometimes. It's so bad. It's very important to listen to a person talking. If you see those swelling of the face and things like that, you need to go ahead and call 911. And it may get to the point also where you hear things like this. These are other giveaways or symptoms of a severe allergic reaction or anaphylactic shock. The way they talk. they will say things. A child will say things like, "I'm having trouble breathing. My tongue feels thick." They'll talking like that as the mucous membranes of the tongue and the soft tissue of the throat begin to swell shut. It may reach a point to where the tissue, and I want to change my voice a little bit here, the tissue pushes against the vocal cords to the point where there's swelling and the vocal cords are affected. If that point is ever reached, you might not be for but a couple of minutes away from doing CPR, because you're going to get respiratory arrest and set in very quickly in that situation. Now we have EpiPens, and they're prescribed, and they're only used on who they're prescribed for. That's very important to remember. And we'll talk about EpiPens more, and I'll give a little demonstration in just a few minutes on the EpiPens. In any situation, if you ever expect any type of systemic or severe allergic reaction where the whole body is affected, anaphylactic shock is occurring, call 911 immediately. Call and follow the instructions that the 911 dispatcher gives to you. And always keep that Benadryl in the cabinets, and always keep your EpiPen handy if you are prescribed an EpiPen. And let these kids get dirty. Let them get dirty, and they'll hopefully build up these resistances to these mild allergic reactions, or severe allergic reactions, or allergens, I could say. You know, another thing before we close here I want to talk to you about, there's been studies before of children that sleep with dogs and animals, dogs and animals. Well, dogs and animals go running through bushes, and they get all this bacteria and fungus and mold on their body, and of course they emit dust and dander themselves. And it's been actually found in some studies that there's a positive correlation between owning an animal sleeping with a child, and a decreased chance of a person or that child or individual having any type of allergies. And they think that maybe dogs and pets that sleep with children bring in these allergens. The child brings them in, and they're slowly subjected to these allergens, and they build up a tolerance to these allergens. So, you know, nothing wrong with Rover sleeping with the kids and things like that, as long as they get good proper rest. Thanks a lot for watching, and we hope you stay tuned for the next video too. You take care and have a good day. Bye-bye.